Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. How to control no reason laughing, please guide.
Yeah, so you should join us when we do a segment, or if we have our dear friend Julie Matthews or some other nutritionist on the show with us, because no reason laughing from a behavioral perspective is one of those tactics where our kids kind of delay things. They just want to delay, but more often my experience has been that it is yeast related, and I've seen that, believe me, a lot. And I've seen a lot of kids they look drunk. They look like they're walking around drunk, and they're just giggling.
They even will smell like brandy sometimes in their mouth, or their heads or their feet will smell like fresh baked bread. You can smell the yeast.
Well, I would definitely do a rule out of yeast issues, which essentially means that you'd want to see a functional medicine physician or a nutritionist or a dietitian, and they can help you, first of all, test for and see if there's excessive yeast. That's a stool test that you can do. And once you know that, then treat the yeast, because yeast candidiasis in general does tend to be a big issue with a lot of our kids, fungal infections. So that would be very important to do. And if it's not that, the other thing that I sometimes see is our kids remember something that they've seen on a TV show or whatever. And with typically developing kids, they also do, but the difference is they will say, I just remembered blah, 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 and they'll give an introduction to what it is they're thinking. And our kids don't give that introduction. So the first thing is, if it's like random times and it doesn't appear to be necessarily connected to something they've seen before, then I would really go for treating the yeast, figuring out if it is yeast. But if it does appear that, your child often laughs also when they see a particular segment and they repeat that segment, then it just could be that they're remembering something funny and they just don't know how to say it, how to introduce that.
Yeah, so true. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.